I'm the lead and corresponding author of our recent paper published in Rural and Remote Health. A competent and efficiently utilized workforce is the backbone of any resilient health system, particularly in low and middle income setting. To understand how healthcare providers maximize their time and navigate operational challenges, our team conducted a multi-site time motion study in Ethiopia. I will briefly share our core findings regarding how hospital-based health professionals allocate their working hours, the system bottleneck they face, and the practical low-cost management strategies needed to optimize the healthcare delivery. Study population and participants. So our study observed a total of 180 hospital-based health professionals across multiple countries with 100% response rate. The observed workforce was remarkably young, which means more than 60% were under the age of 30 years and nearly half had less than 5 years of work experience. This demographic profile highlights a vital early career workforce that represented the future of our health system. Key findings on time allocation and productivity. When looking at time allocation, we found that health professionals spent on average 5.5 hours per day on productive activities, accounting for nearly 70% of official working hours. Among these, direct patient care constitutes or take up about 37% of the workday. On the other hand, roughly 30% of official working time was spent on non-productive activities. Crucially, this was not driven by individual weakness, but rather by systemic inefficiencies, primarily waiting for patients due to unsynchronized workflow, which consumed nearly 10% of the day alongside necessary operational breaks. Interestingly, we observed cross-cadre uniformities. There was no statistically significant difference in productivity between doctors, nurses, midwife, laboratory, or pharmacy professionals. This provides that time loss is a facility level systemic bottleneck rather than cadre-specific issues. The paradox of perceived workload. One of our most striking findings was a clear paradox. Over 76% of the health workers perceive their workload as excessive, even though the observed data showed 30% of their time was non-productive. Why does this mismatch occur? In a resource-constrained setting, clinical workflows are highly fragmented. Workers experience alternating periods of intensive, stressful patient surges and long stretching of enforced waiting due to supply stockouts or travel delay faced by rural patients. This unpredictable environment creates a sustained sense of pressure. Combined with low incentive coverage, where fewer than 18% receive any financial and non-financial incentive, job satisfaction was only moderate, and nearly 40% of participants reported planning to leave facility in the upcoming year. Through multivariable regression, we identified that advanced postgraduate training, year of experience, higher daily patient volume, and receive regular performance appraisal significantly increase the odds of hitting a highly productive workday. Based on this insight, we have proposed 5 intervention or recommendations. The first recommendation is optimize patient flow. The second is stabilize point of care readiness. That means utilize simple physical bin card and weekly clinical logistic handle to proactively manage drug and supply stock out. The third recommendation is having formative supervision. That means institutionalize local non-monetary recognition system to decouple performance feedback from rigid civil service law. And the fourth one is, peer upskilling. That means creating a structure on the job mentorship through pairing newer graduates with the experienced postgraduate staff. The last and the fifth recommendation is safeguard well-being of the workforce. In conclusion, Our study shows that avoidable non-productive time represented a valuable efficiency reserve. By focusing on workflow optimization, supply continuity, supportive performance management, we can meaningfully improve capacity and enhance service readiness. Along this low-cost management approach with broader health system strength will pave a clear path toward universal health coverage in Ethiopia and similar cities. Thank you very much.